Hi, for this video demonstration, we're going to continue on from the previous video, which was the overhead squat assessment. In case you missed that one, overhead squat assessment is when you have the client stand with feet shoulder width apart, toes facing forward, and the client put the arms over their head, and then squat down to height as if they're sitting into a chair. Now, there's a couple postural deviations which may occur, and the one that we're going to focus on in this video is the arms falling forward. So this one is quite evident in the lateral view, which is the side view, so the shoulder or the client puts their arms over their head. Either can't go up all the way, so you just want to see a little bit of the ear there. You see the whole ear? Arms already, you're already kind of aware that the arms are going to fall forward. But if they are up here, and they squat down, you can notice the arms drop. This is another general cue that there may be some overactive muscles here. Now the muscles generally overactive for arms falling forward are the coracobrachialis, the teres major, the pectoralis major / minor, and the latissimus dorsi. Now it's always important to watch static posture of your client, or even just when they're walking. So you walk or when they stand, you kind of notice that you can see the back of their hands. When you're facing them, you can see the palms right behind them. This is a general cue that we might have some overactive muscles here. And in particular, the pectoral lat, what they do is that they attach in the front of the arm here. So when the arm is rolled, when the shoulder is rolled forward, you see the back of the hand. This brings these two muscles closer together from the origin of insertion. And this generally happens when these muscles are in contraction. So to help lengthen them, so that they're back to normal posture, we're going to go over some self-myofascial release techniques. We're going to go over some static stretching techniques, which will help return back to the resting leg, as well as some neuromuscular stretching techniques, which will also help return them back to the resting leg. The first lengthening technique that we're going to talk about here is self-myofascial release. In case you're unaware of this technique, it is quite often performed with a foam roller here, being an exercise tool, and this helps release knots in the active muscles. Now these knots, they generally occur from microtrauma, which is induced either through exercise or just overuse of the muscle when they're continually in contraction. And this microtrauma creates micro tears in the muscle that results in knots. Now these knots, they create obstruction to blood flow and prevents blood and oxygen to get into these working muscles. This is evident when you're exercising. You get more fatigue, stuff like that, or you feel the muscle quite often tighter, you push into it, it quite hurts. This is significant to be there being knots in these muscles. So the first muscle that we're going to go over would be the pectoralis major, one that we diagnose as tight to the overactive or to the overhead squat assessment. Now, as a trainer, it's always important to keep an eye on your client. When they perform self-myofascial release through the foam roller, it can be quite intense and the pain can be quite severe. There's different levels of foam rollers. You can get really firm, as this is a nice firm one. You can also get softer ones. Now, I always keep an eye on the client's facial expressions. If they look like they're in absolute pain, or they're cringing, their eyes are squinting, you might want to grab a little softer foam roller there. And with foam rolling, you want to perform approximately one set between 30 to 90 seconds. So 90 seconds being more specific for older clients where the intensity is not very high, so you can feel slight discomfort, not a whole lot. Then you feel major discomfort, you only want to go about 30 seconds here until you feel the muscle release or the pain disperse. Now for pectoralis major, what we're going to have to do, we're going to perform both sides. But for this video, we're just going to perform only one side. And we're going to have the foam roller approximately 45 degrees to the body. With the client lying face down, we're going to have them put the arm up and put the thumb towards the sky here. Now we're going to have the client maintain an engaged core and an engaged glute, because you kind of want to get away from bad posture when foam rolling. So you don't want to have a client who has a major low back arch when they're foam rolling, as this kind of puts unused stress on the skeletal posture. As the client foam rolls, we just want to have them kind of push their body just feet up the leg or the arm, and slowly going forward until, if you're present with the client, you might see their face kind of cringe. That generally means they hit the right spot. But if you're working with a client who's either distant or away, and you give them general ideas through videos or emails, you just want to ask the client or inform the client that just roll along the muscle until they feel a spot where they feel slight discomfort and tightness, and just hold there for about 30 seconds. So just going to hold here for 30 seconds. After 30 seconds, we generally want to switch sides. We want to make sure we do both sides of the muscle, but for this video demonstration, we're only going to work on the one side just to save a little bit of time here. Now the second muscle that we're going to do is latissimus dorsi, being on the back. Now this muscle is generally responsible for the arm pulling downwards. The femoralis muscle, the same thing. If you're with the client, keep an eye out for the client making cringing motions with their face. To do that, you generally hit the right spot, but make sure that the pain isn't too intense. So the client lie on their side. We want to keep the body straight as we try to keep good posture. Have the client lie so that the thumb is facing up. And now one way that the client can do this on their own, so they can roll, is they need to keep one leg straight, keep the hips stacked, and use this leg just for a moment to roll up. Now it's really important that the client does not roll over any joints. So we want to keep the foam roller so that it is not on the ribs. We want them to lean back a little bit, but not so far back that they're on the shoulder blade. So you're just going to have the client just roll a little bit until they feel a nice tight spot in the muscle. You're going to hold here for 30 seconds. After 30 seconds, the client can release and then switch sides. And once again, we're just going to focus on one side for this video demonstration. Following our self-myofascia release technique using the foam roller, we then want to move into some other lengthening techniques, that being static stretching. Now, static stretching is important because this returns the muscles back to the normal resting length. Now keep in mind, you do not want to do static stretching right before you perform exercise if you're doing strength or running, because static stretch, it causes the muscle to lose that stretch reflex action, as when you stretch, you kind of tell your body, don't contract. And as you're running, you want quick contraction of the muscle so that you bounce off the ground. Now, static stretch, it kind of gives the muscle spindles to relax. Now, this is good for returning the muscle back to resting length, but bad for acquiring strength and balance when running. So for this stretch, we're going to use a door frame here, which your client should have access to something that is either elbow width apart, or if they're a little bit shorter, they can also use their hands on the door frame. As long as they can get their body through it, that's generally what we're looking for. So once again, similar to statics or similar foam rolling, we want to have the client retain ideal posture. So keep the head in line with the torso. So norm the client looking down, up to the side, etc. You have the client engage the core and the glute, just to avoid any low back arch. Now we're going to have the client perform 1 to 4 repetitions of static stretching. This can be done daily, between 20 and 30 seconds. And for older clients, generally recommended, who are above 60 to 65, to perform 60 seconds of static stretching. Now for the chest stretch, we're just kind of stand at the door frame, have your arms each side of it. You're going to step 1 foot forward. You're going to lean into it while engaging the core and the glute to keep a nice straight torso. You're going to hold this for 20 to 30 seconds, and this will really open up the chest. After 20 to 30 seconds, you will have the client release, and you can generally feel the chest already looser, which is great. The second stretch we're going to do would be the latissimus dorsi here, and you can also use the same door frame if the client is tall enough. And this one is generally same thing, keep the body straight. Head in line with the spine, same thing, knee go forward. Have the client lean in for 20-30 seconds. However, if this is not acceptable for the client is a little too short that we can't reach the door frame, you can also do this one on your knees. I'll be right back with the bench. Actually, this chair works quite well. So if the client can't quite reach the door frame, what they can do is that they, on their knees, just going to lean forward and bring their body towards the ground. Now, as a trainer, if the client is present, you want to make sure that the client doesn't have a nice low back arch. You want to keep the body straight. Keep the head in line with the body. And the client is going to use gravity to assist the stretch. You hold for 20 and 30 seconds. Now, after 20 and 30 seconds, you want to have the client switch arms. But once again, for this video demonstration, we're only going to do the one arm here. Back to our lovely door frame here, we're going to move on to neuromuscular stretching. Now, the type of neuromuscular stretching that we're going to perform here is the hold relax with agonist contraction. Now, this is the most effective method for returning the muscle back to resting leg, as it involves both reciprocal inhibition and autogenic inhibition. Now, with reciprocal inhibition, this allows activation of the opposing muscles, and with autogenic inhibition, this involves relaxation of the target muscle, one that we're stretching. So you're going to get a double bonus here. In the very end, this stretch will be a lot deeper than the beginning. So with this stretch, we're going to begin the same one as a static stretch. So have the client maintain neutral body alignment, so engage the core, engage the glutes, head straight, just to prevent any deviation posture. The client go into the stretch, and we're going to perform 1 to 3 repetitions. And have the client push against the door frame with their hands. So this is the contraction phase of this neuromuscular stretch. So they'll be pushing against the door frame for 7 to 15 seconds. Following 7 to 15 seconds of contraction, the client is going to go a little bit farther into the stretch and hold this for 20 to 30 seconds. Following this stretch of 20 to 30 seconds, the client is going to perform another contraction phase. Then you push against the door frame for a following 7 to 15 seconds here. Following the 7 to 15 seconds of contraction, the client is then going to move even farther into the stretch for another 20 to 30 seconds. In the final stretch, it will be significantly, or should be significantly more than the initial stretch. With neuromuscular stretch for latissimus dorsi, we want to make sure that we have the muscle acting in the same way that it normally acts. Now, latissimus dorsi is responsible for bringing the arms above the head, for bringing the elbows back to the body through abduction. Now, for this stretch, we want to do very similar to pectoralis major. We want to have 1 to 3 repetitions, a contraction phase of 7 to 15 seconds, and relaxation, which is the stretch phase, of 20 to 30 seconds. Now, for both these stretches, we want to maintain the contraction phase at an intensity of 20 to 25% of the client's maximal strength. So for this stretch here, we're going to utilize a nice elastic resistance band here for the client. Sit in ideal posture, so the head in line with the spine. Core engage, just to prevent any arching in the back. The client go above, put their arm above their head so that, move the bench a little bit forward here. So you see that the arm is in line with the elastic here. So the client go as far into the stretch as they can. This is where I grab the elastic. And then have a contraction phase for 7 to 15 seconds. So I pull back the elastic. So I bring my arm down to the ground. I hold this for 7 to 15 seconds. Following 7 to 15 seconds of contraction, I go farther into the stretch by reaching farther up in the elastic. I hold this for 20 to 30 seconds. Following 20 to 30 seconds of stretching, we're going to go back into the contraction phase. So we're going to bring the elbow back down to the ground for another 7 to 15 seconds. Once the client has performed the second set, they're just going to go back a little deeper into the stretch for another 20 to 30 seconds. Now after 20-30 seconds, the client should notice, similar to the pectoralis major stretch, that the muscle has significantly decreased in tightness. So when the client puts their hands above their head, we perform the overhead squat assessment in the previous video. Hopefully the arms do not fall as far forward or not forward at all, as we have done the job of lengthening these muscles, return the back to normal resting length.